How to create your own health plan. I mean, literally nobody talks about how to be healthy. Not healthy foods or healthy waters. I'm talking about the whole package, the whole plan. I mean, everybody knows what to do, when to go to the doctor, when to get drugs, what diseases to watch out for or get tested for. But why don't we talk about health? How to really be healthy. Add 30 of the best, healthiest years to your life, or understand what are the few things that we may not be seeing, the things that may be right underneath our nose, every pun intended, or the things that are hidden in plain sight, the things that we may know about but may not be paying attention to that really get us in trouble, that really harm our health the most. And the reason why I say it that way is because think about it. I mean, we are all extremely intelligent human beings, maybe some more than others. I have some moments myself, but what I mean is we all are human beings and we make mistakes, but we don't intentionally or knowingly do things that will harm our health or kill us. But every single day, especially here in this society, if we operate in the US healthcare system, especially not realizing that this is one of the most, it is a for-profit healthcare system, but it's also one of the most confusing as far as healthcare, because we have this system, right, where we have a health card and we're giving health insurance, but it really doesn't insure, or it really doesn't cover the most important part of our body, the mouth, unless if we have specific education and knowledge in knowing how to communicate that to the health plan or the insurance company, or how we can even know what, dentist, what doctor, or what person we need to go talk to. Like, if you don't even understand, if we don't even know about what a health planner is and what they can do for us, we wouldn't even know to look for one, for example. So the first thing that I want to talk about when it comes to understanding our health and setting up our health plan is this concept of health starts from mouth. It's a philosophy and a concept that we want to apply to our health plan. And the reason why is it's the best and most fundamental way or perspective to look at our health. And until I find a better one, I'm going to continue to teach, to talk about, and to train other people to adopt this health starts from mouth mentality also. I mean, if you've been around the health block and if you've been studying health, and even if you haven't, you've probably heard about that whole probiotic or gut health phase. I mean, some people are just now talking about it, and there's new books being published about it even now, where they talk about the gut and the body connection, that the health of your gut is intricately and almost determines the health of your overall body. Now, if that's the case, and a lot of people accept and have adopted that mentality already, I would offer that the most fundamental thing is, if our gut is where health starts, then the mouth is where our gut's health starts. So if we think about it that way, health does start from the mouth, and so does disease. And when it comes to health planning, we really want to set ourselves up for the best shot at success. And we're not going to be able to do that by ignoring or not paying attention to the common pitfalls that most people fall into. So let's go ahead and address those one by one. We'll start from the top. And we're going to go through some of the fundamental health things that I think everybody should include in their health plan. And this is just an overview. If you want more information, I've created a health planning guide. And of course, that will be in the links down below. So when it comes to your health, I would say the number one thing that we should pay attention to, or we should have, is a health plan. Like they say, if you fail to plan, you plan to fail. And in the same way, if you don't have your own dreams, very many times we'll find ourselves building somebody else's dreams. So along the same lines and that philosophy, it applies to your health more than ever. Now, I think the most confusing thing is we have a health plan that we buy from insurance companies or from the government that's given to us, but this isn't something that we plan for ourselves. And unless if we plan a personalized health plan that's customized to our needs, we're not going to really be planning our best health. We're going to be planning profit for other companies when we're sick and when we don't have our health. So that's why the health planning concept, or to have a health plan, is the most important thing. To be a little bit more intentional and to put yourself in the driver's seat of your own life as a person first, so that way you don't ever have to become a patient ever again. I mean, in this society, we've normalized being a patient and being sick to the point that we're convinced that it's actually a good idea to go get tests and go get cancer screenings and go check for flus and viruses. But I'm going to share with you that there's another way to think about it. And the doctors that have actually done the evidence and actually have visited groups of people or societies that do the testing and the ones that don't, you're going to be shocked when you realize the truth behind that. So I'm not going to talk about that right now. Stay tuned and we'll talk about that more in depth in other videos. I'll have a whole video dedicated to just that topic of whether we should test, whether we should be screening for diseases and cancers, and not just for my opinion, but we'll look at the actual evidence and the actual data, the numbers. And you're going to be shocked. But what I will say is we spend 2.5 times more per person in healthcare in this country, the US, yet we're ranked. We used to be ranked 35 and 36, but now we're ranked 69. That puts us well amongst the bottom countries, and we have the worst satisfaction. People are unhappy, and we are rated literally the worst in health outcomes in our healthcare system. I don't think there's literally a more embarrassing part of our society here in the US. It doesn't matter how much money we make, how much makeup we wear. I mean, if we're sick and all of this stuff is fake, what does it matter? We're talking about, fundamental health treatments, cures, or healing aids that are available everywhere else in the world except for America. I mean, there's a lot of things that are available. For example, ozone is available in a lot of other countries except for America. Mistletoe is a cancer treatment that is available in every other country legally, except for in America. Does that mean that all of a sudden when it gets shipped to America, it doesn't work? Or that it's less harmful in other areas when you use it in other parts of the world, but it's all of a sudden when you use mistletoe on a human being in the US, it all of a sudden becomes harmful? I don't think so. So this is not the time and the place to talk about those things, but let's talk about the fundamentals of health. Is first, having the health plan, and then two, is understanding the importance of hydration. Everybody knows it, but everybody's been tricked. The US has the largest water bottle market in the world. And it goes without saying that when we're in a for-profit capitalist society, many times we're going to be tricked. We're going to be marketed and we're going to be sold on something. So we buy a product, a good or a service, and it may not be for our best interest. Alkaline water is one of those things that I used to think was good, but the more research I do and the more blood tests and the more evidence and the more people we talk to, we're finding out there's nothing good about alkaline water. And you don't want purified water either. That's just tap water. And most purification systems were designed 50 or 100 years ago, and it's just simply not enough to remove the harmful elements, contaminants, and toxins that are in the water today. So what you want is you actually are looking for spring water, structured water, and any form of living water. Water, one drop of it has more energy than a nuclear bomb when it is living and when it is full of energy. That's literally why they created the hydrogen bomb. So we forget that and we don't think about it, but literally there is a difference between clear water that comes out of the tap and clear water that is truly living. Number three, but the second part of health planning is food. Now, a lot of people understand the concept of eating healthier foods, of organic, of GMO, of all of these things. Now, I will say one thing about food is it doesn't matter even the quality of food, although that is one of the most important things we do need to be mindful of. But you could have the best quality food, but if you don't understand your allergies, you could also get yourself in trouble. So the number one thing we have to understand when it comes to the food production system is that the foods that are mass produced most vegetables and fruits, actually almost all of them in a conventional grocery store, even though it looks like a fruit or vegetable, when you put it under a microscope or when you test it for the nutrients, it doesn't even compare. If you looked at the nutrient profile, some of them are depleted. They have half of the nutrients that they did before. Some of them have less than 20%. So at the end of the day, you're just eating something and chewing on something that has water in it, that has a little bit of flavor, and it's mostly fiber, cellulose to maybe, brush out or sweep out your insides, but without the minerals, without the nutrients, and without those things that really support cell health for our cells to communicate and to power our cells, then we're really slowly decaying. We're slowly dying, even though it looks like we're eating healthy, organic, even GMO foods and fruits. We have to make sure that these are grown in the highest quality and either from a farm that where they properly rotate the crops. And it doesn't matter that it's organic and GMO if you overuse the ground. So that's the first concept with food. But the second concept, nobody's really talking about this right now, but I know they're going to be talking about it. It's going to be the biggest topic that you'll see in health in the future, is food allergies. You may have heard about it, you may have talked about it, but people don't realize almost everything that we go to the doctor for or go to the hospital for right now is a chronic food allergy that hasn't been uncovered and it hasn't been found out. So when you eat something that constantly creates mucus and sludge in the body, then you're going to end up in trouble. So the third thing on the health plan that I want everybody to be mindful of is, now that you understand, the quality of food and food allergies, you want healthy water, is to understand this concept of detox and parasites, right? But everybody knows detox, but some people may not think that there's actually living parasites inside your body. This isn't just something that happens in Africa. It happens from our food production system or from foods just not properly being cleaned. So if we have parasites in our body, we do want to find a way to remove and get rid of any of the parasites that are really living in our body and stealing our energy, stealing our nutrients, and laying a lot of waste that, can cause infection and a whole host of other issues inside our body. So a lot of people may talk about how to do a parasite cleanse, but the reason why I talk about it with detox is if you get the right zeolite, if you get the right parasite cleansing solutions, a lot of that will clear them both up at the same time, but it all does not work with the right water. Okay, so those are kind of the fundamental things that we should be looking out in order to have good health. And literally, it's that simple. When you remove these things, all of a sudden health pops back into place. And I would say this final thing when it comes to hacking healthcare, or if you don't like that word, navigating the healthcare system. I mean, we've normalized going to a dentist or a doctor so much, but people still don't know how to go. So just like it wouldn't make sense that if you were in a hospital to go directly to the surgery room, because maybe you don't need surgery. And especially when it comes to surgery, especially when it comes to dental implants or any dental surgery, same thing. These are permanent procedures and they do change your life, your health, and even your ability, your potential for health and your potential to heal at the very, the second you get cut open with a surgery, it is ruined or it is extremely limited. Now, the ancient people and the ancient cultures realized this, and that's why they protected acupuncture and herbal tonics, and they used these first before they ever went to surgery. They got rid of those, more effective treatments or ancient proven methods in the US in order to sell pharmaceutical drugs and surgery, but it doesn't mean it's more effective. In fact, in the US, they just deleted other things that were more useful, and they brainwashed, or they decided, like doing a bait and switch, that these things didn't exist. But it doesn't change the fact that when you go to a doctor, and this is probably the more important point that people miss, especially if you've already been to the healthcare system, or if you've already been inside the system in any which way. Like if you've ever visited a dentist or doctor, this is arguably one of the more important points, if not the most important point, especially when it comes to ever considering walking inside a hospital. Of course, you got to get the water and other things right. So get those right. It's not more important. But outside of that is understanding that 70% right now in our healthcare system, especially 70% of all heart disease and breast cancer starts from the mouth. And if I could tell my younger self, it's not going to a doctor, because 90% of the time, actually, all things that we go to a doctor for or a hospital for, or we think we need to go to the healthcare system for, it would be in our best interest if we went to a dentist first. Now, like one of my mentors tells me that really has studied this stuff, the orthomolecular side, which is the evidence-based studying what actually affects health, not just to sell a drug, but really looking at the whole picture. He says the worst thing that you can do for your health is to see and submit to a conventional dentist, a chemical using dentist, one that promotes root canals and like silver fillings, like mercury inside your body. But the best thing that you can do for your health is see and seek out a ozone using biologic dentist. It's literally the best thing that you can do for your health in this conventional healthcare system. And the biggest hack or the biggest trick that I figured out over the last 7 years, helping myself, my patient, and my friends, family, and other patients now to help navigate the healthcare system, the biggest thing that I found out is that medical insurance and Medicare will actually cover dental. They changed the law just 2 years ago. Most people don't know because they're not in the field, but Medicare actually opened up their definition of what they will cover in dental. So even before 2 years ago, a lot of the things that they openly covered, it was very small, understandably. But now they cover, anytime it is dental with cancer, anytime it is dental with any serious or chronic, disease that is life-threatening. They really opened it up. But all of the dental reasons don't matter. 9 out of 10 times, or actually probably closer to 99, but let's just say 9 out of 10 times when we have somebody that's 65 and older that came into one of our dental practices, they had some medical condition or some infection or some kind of decay inside their mouth. So when we look at it from the medical perspective, Medicare will pay those patients or pay that dentist to remove that infection every single time that they have it. So every single time we send in a claim, they got paid 99% of the time. And I just want to share that because most people think that they have to pay out of pocket going to a dentist, but that's simply not true. If you go to a health planner or you hire a health planner, they'll be able to assess your needs, talk about your health plan, and based on your health plan or what you want, they'll be able to fit you to the right treatment and the right dentist. The problem is, just like the hospital example, if you just go into a dental office first, you're going to get sold on the treatment or the procedures that they offer at that practice only. And even if they're a larger practice and offer everything, they're still most likely going to, focus on whatever they have available there. But no practice I've seen offers everything. So what you want, and what I would do, what I would want for myself is a health planner, one that's I hire as a person or as a patient to help me first, not to sell for some dentist or some health plan or some pharmaceutical company. A health planner is somebody that I hire, for myself as a patient. And what they're going to do is they're going to educate me, coach me, and fight on behalf of me, with the dentist, with the health plans. So that way I get paid from my health insurance or my health plan. So that way I can pay the dentist with that money that I've already paid for. And I don't have to double pay, I don't have to overpay, or I don't have to be ripped off just because some dental office manager or some dentist doesn't know how to do medical billing. And that's really it. It's just that these dentists keep saying it's not even true anymore, especially in the last 2 years. Medicare does cover dental in a whole bunch of different lists of cases. But the reality is they're not doing any medical billing or Medicare because they don't have a medical biller. And more importantly, even most medical billers don't know this, they don't have a health planner. And that's really what we're looking for. A health planner is somebody that has dental experience and knowledge, that also understands the general other options out there. But most importantly, they can help a patient find the treatment that they need to solve the root cause of their problem, if and it is dental. And if it is, how to get it paid and covered from medical insurance, from your auto insurance, or even workers' comp if those apply. So I hope that makes sense. To summarize it, you want to do the healthy water, avoid, alkaline or purified or any of those scams. And a lot of people have now seen that most bottled water have really high amounts of nanoplastics in it. You want to have healthy food, okay? But it's not just the quality of food. We really want to understand the food allergies that are specific to us. And then everybody knows of detoxing, but it's not just the chemicals. It's not just the, the radioactive material and, the things that we don't want, like the perchlorates and the fluorides. We want to remove parasites from our body as well. And then the concept of navigating healthcare is understanding that health does start from the mouth. We usually and typically would better benefit us instead of a facility, a health plan, or a provider to go, to a dentist first, but not just any kind of dentist, a healthy dentist. And then finally, understanding that with a health planner, that you actually can get medical insurance to cover most, if not all, actually, of your visit at a dental office. You just have to consult a health planner or learn how to do it yourself, and you can. I wouldn't recommend it just as a patient, but you can learn if you want to just check if you're getting ripped off, or if you're ever considering to work at home in the dental industry. This is something that you absolutely can start a career in. The opportunity is wide. As I've mentioned, there's only about 3% of dentists right now that are doing this, and not even all of them are active. So there is a huge opportunity, because I don't think dental is going anywhere. Last time I checked, everybody that's born is still having teeth, or they grow into teeth. And so I say that, jokingly, but dental is one of the most solid industries of healthcare. And if anything, it was the dormant, shut down industry that is now being revived and is being restored to its rightful place in healthcare. And whereas dentistry was kind of seen as like the stepchild that nobody really paid attention to, as we restore oral health, the entire healthcare industry is a $1.2 trillion industry. Dental is a $1.5 billion industry. It's a tenth of it. As dental matures, I expect it to grow to at least 60% of the entire industry, but all markers are pointing to actually 70 or 80%, because it should be the leading front end. And we actually may see it completely swap to become 90-10. And I think that that's actually the best way and the way it should be designed. So that way people can get the cosmetic and the medical needs of their mouth addressed. Because let's be honest, medical is medical, but if you can't go to work because of whatever issue, I think it's a disability, but if they call it cosmetic and you can't go to work because of your teeth, last time I checked, you can't eat well. And that's, call it indirectly or call it very directly. If you're not able to put food on the table, or if you're not able to properly chew your food, I'm going to say that's more of a disability. Now, that's kind of a sneak peek into the next videos and what we're going to talk about, and exactly the strength of your request and your demand as a patient. It will be heard, but you just have to understand how to communicate it, what to say, and how to do it in the right way, so that way it's a strong case and something that no one can doubt and everybody will actually support you on. Because if you do this the wrong way, you can come across as someone that is trying to trick the system. But there's nothing farther from the truth, and there's nothing farther from the intention of this mission, which is for everybody to understand, 4 basic concepts when it comes to this movement and when it comes to this philosophy that we call health starts from mouth. So I'll end with this. The first thing is that health does start from mouth, and so does disease. The second thing is that the mouth is part of the body. Literally, no matter what we do, no matter what insurance companies say, no matter how much you divide the money, the dollar, the coverage, the mouth is part of our body. And not just any part, it's the most important part of our body. It is integral, it cannot be separated. And then the third point is health is from head to toe, meaning you can't have isolated health. You can't just have mouth health or eye health or heart health. They try to tell us that, but it's a lie. You're either healthy or you're not. You're either healthy as a whole or you're not. You're either healthy on the cellular level and each cell makes up our whole, or you're not. So I would say you cannot have a healthy body without a healthy mouth. And the final thing is dental is medical, and in every other country, dentistry is a specialty of medicine. And so that's why I say dentists are doctors. I mean, we all know it, but everybody in the healthcare system or the way we're taught to navigate it is just, it doesn't benefit you as a person. So let's put that back into its place. Let's put you back in the driver's seat of you as a person so you don't ever have to become a patient. Remember, health starts from mouth, dental is medical, and we'll see you in the next video.